Hi all. Thank you very much for the support you had given for the previous video, that is critical concept of BLS and the explanation regarding the critical concept. So today we are going to discuss about the use of AED, the Automated External Defibrillator. So as the name gives, so defibrillator, we are going to shock the patient or defibrillate the patient. So what are the times the defibrillation is required or we want to give the shock? Mainly for three rhythms we are giving a shock. One is ventricular fibrillation and the other one is pulseless ventricular tachycardia. These pulseless ventricular tachycardias are two types. The one is pulseless monomorphic ventricular tachycardia and the other one is pulseless polymorphic ventricular tachycardia. So total three shockable rhythm. Certain people, they will say that only two rhythms shockable rhythm. One is ventricular fibrillation and together they say pulseless ventricular tachycardia or pulseless VT. Anyway, all are the same concept. Now these three are only the rhythms which really require defibrillation. I just wanted to mention one thing over here. There is a difference between cardioversion or synchronous cardioversion and defibrillation. I'm not going to discuss the rhythms which require synchronous cardioversion. It's only about defibrillation. And the purpose of using AED is, see, majority of the time, AED, the main thing is even it can be used by a lay person, no need of a medical knowledge. So only medically competent persons, those who can able to read ECG properly, or when they see the rhythm in the monitor, if they can interpret this is ventricular fibrillation or pulseless VTAC, they can determine that okay, patient is in this condition and they can deliver the shock. But there's certain situation, it may be always all are not confident enough to read or diagnose the ECG abnormalities. So such situation, the AED will help you. As the name indicates, automated, the machine itself will determine whether shock is required for the patient or the person is having a shockable rhythm. That is again VF and pulseless VTAC. So same like ECG, it is not electrodes, but we have to attach two parts. And usually for all adult patient, one is on the right side, that is just below the clavicle bone, and the other one on the left side, mid axillary line, just below the nipple line. You can keep the parts. And even though you have a doubt, actually AED is having prompt, they will direct you, and pictures are also there in the AED part. While looking itself, you can show it. Maybe I will do a separate video on this demonstration of the use of AED. Now, so once the AED parts are attached, so the AED will analyze the rhythm, and if it is a shockable rhythm, AED itself will charge, and only your responsibility is to press the shock button to deliver the shock. The only one thing which you have to be extremely careful about while giving the shock is, because nobody should touch the victim, because if someone touches the victim, they will also get the shock and it will be very fatal. So now actually there is a lot of misconceptions are there regarding the use of, why we are giving shock. Actually, when we give the electrical shock, we are stopping the electrical activity of the heart. When we stop the electrical activity of the heart, actually the heart itself will stop. So as soon as you deliver the shock, it is our responsibility to immediately start with the compression, because by giving defibrillation, you stop the heart, all the electrical activity of the heart. So immediately start with the CPR. There are certain special considerations are there while using the automated external defibrillator. There are certain times, especially the male victim, if they have excessive hair on the chest and the parts may not be attached with the victim properly. So such situation, what we have to do is either quickly remove the hair with a shaver or with a trimmer, ideally a trimmer, but what is available, quickly remove the excessive hair and attach the parts. And the second concept, the special consideration is if patient is having excessive sweat or patient is lying down in the water, so the parts may not get attached properly. So quickly wipe the chest, then attach the part and proceed with the monitoring the rhythm, and if required, go for shock. The next concept is if patient is having some medication patch attached to the area where you are going to stick the parts, remove the medication patch with a gloved hand and wipe it. After removing it, wipe the medicines away, then attach the parts, and you can safely use the AED. And one more thing, there are certain times patient may have implanted pacemaker. So such situation, AED is not contraindicated, but you can see a visible lump-like part on the chest where these pacemakers are implanted. So never ever keep the parts of the AED on top of the pacemaker. So just below that you can keep the parts and you can proceed with the analyzing the rhythm and proceed with shock. You have to understand one more thing. There are certain times AED will say no shock at twist. So that may be a non-shockable rhythm, like it may be an asystole or a pulseless electrical activity. Such situation, AED will say no shock at twist. So it is our responsibility to start with the compression because that is non-shockable rhythms. So I hope that it is clear for you. And even though you wanted to know more about this ECG and all, we are running a one full day course about this electrocardiogram where student will be confident and competent enough when nurses or students able to learn the different arrhythmias, the major arrhythmias. So do contact us, we'll give the training. And we assure that you'll be confident enough to read all the abnormal and normal ECG patterns. Thank you very much for watching and we'll see you in the next video.